I'm currently employed by the Medical Arts School, which is a massage therapy school in Raleigh, North Carolina, and I teach massage therapy.
I'm a teacher for toddlers at our Playhouse House preschool in Guerrero. I think part of what would be cool in terms of like health insurance or like even like healthcare practice is to actually have a support structure where you're not kind of learning this on your own, unsupervised. If we apply for insurance, like the only thing we would go to the doctor for would be if we were really, really sick. Everything else, like it's not worth it to sit 4 hours in an emergency room when the office is closed, or to schedule an appointment with a doctor whenever it's available to go in.
I mean, I feel like our choices are to pay a lot of money for an inferior product that's already way overpriced. And like, I don't feel like there's another choice for accessing the healthcare system that's not pay more than it's worth and get less than you deserve for that. You know, the other option I have is to not pay for health insurance, and then if something terrible does happen, well, then, you know, I can't, you know, there's no way I'm going to be able to pay $100,000 for like a 3-day hospital stay. You know, and the rates they're going to charge me are going to be 10 times what they're going to charge an insurance company, because that's just the way it goes. So
I feel like there are places where you can get the healthcare that I would want, but it's just completely unaffordable. Like, it's
right.
Unrealistic to even want that, to even like try to go for that.
Right. So what I would like to see is, you know, basic services delivered, you know, with quality at a reasonable price. I feel like it's more that people are channeled into the healthcare system and then don't receive care that really improves their quality of life. All of the logic that goes into maximizing profit operates in insurance companies just like it operates in any other business. So, you know, profit is maximized when you get the most money coming in and pay the least money going out. And I think that's what ultimately their interest is to have as much money as they can coming in and try to minimize how much is going out.
It's just kind of frustrating because I think like insurance companies aren't really in a place to help shift the system, because really like they're most profitable when they're connected to more drugs. I feel like healthcare really has to go back to taking care of ourselves before we find ourselves in dire circumstances, and I think our healthcare system has to support that.
You know what would be cool is if doctors only got paid when you're healthy, and then when you get sick, you stop paying them until you're healthy again.
I don't know.
That would work, because then they have to keep you healthy or else they get cut off.